So we want to talk specifically in this section about carpal tunnel syndrome. I can't stress enough that if you're having wrist pain or elbow pain or weakness in your hand, pain at night in your wrist or your hand, that you should definitely see a healthcare practitioner to get a proper diagnosis of carpal tunnel. Very often you will just have some simple symptoms like weakness in the hand or a tiredness, and once you go for the test, the conduction test, you'll find out that you actually have a fair bit of damage. So don't ignore this type of pain. But if you have this diagnosis of carpal tunnel, splinting or bracing may be recommended. If it's bad enough, they may recommend surgery. We believe strongly that the Genesis Health Light can play a big role in carpal tunnel syndrome. So what I want to show you in this instance is what we're going to do as far as our treatment protocol for carpal tunnel. We've done some research on this. We've done through some patient studies and are digging deeper into it because it is quite expensive to have people not working because of carpal tunnel, and it also turns into something that doesn't have very good outcomes. And what that means is that very often after surgery people will have a reoccurrence, or the splinting and the bracing doesn't do well enough for them. We really think we can make a difference using the Genesis Health Light for carpal tunnel. So when you're using the Health Light, there's 3 segments that we want you to treat. First of all, we would like you to treat the palm of the hand for 10 minutes on high. So above the wrist, right on the palm for 10 minutes. Then we'd also like you to move down and treat directly on the wrist, just below the crease where your hand meets your arm, for 10 minutes. And because we're following the nerve, the median nerve that goes through the carpal tunnel itself, we also want to treat directly over the elbow, but more in the frontal plane, so not on the side of the elbow, but right in the middle. Treat there for 10 minutes. So you've got a 30-minute treatment. 10 minutes in each spot is what we're recommending for carpal tunnel syndrome. Should see some improvement quite quickly. The time again is 10 minutes. You could do this twice a day, so you could do it in the morning and after work or in the evening. And after 7 to 10 treatments, you should start seeing a reduction in your symptoms. Again, strongly recommend if you're experiencing these types of symptoms that you talk to a healthcare professional to make sure that they also would check out the shoulder and the neck, because symptoms, believe it or not, in your hand and in your wrist could be starting all the way back at where the nerves start, at the nerve root from the neck, or from an impingement or a pinching in the anterior part of the shoulder. So it's important that a healthcare provider checks that all out for you. If you've received that diagnosis and it's bad, but it's not that bad, and you want to get working on it using the Genesis Health Light, 10 minutes, 10 minutes, 10 minutes is the best recommendation.